We're going to go now to our interview with Tony Burris. He is from Eagle Acupuncture, and I want to welcome him. Good morning, Tony.
Brenda, how are you doing?
I'm doing wonderful. Thank you so much for coming in early. This is a discipline that I find so fascinating because, first of all, it has been around forever, and people are often unaware of the many benefits of acupuncture.
Yeah, they are. When you mention acupuncture, people usually think of one thing, and that's the needles, which of course they don't like. But they don't really know about how it can help them. And that's kind of what we do at our clinic, is educate people and kind of let them know that there's many things that we can help them with.
Well, I want to first talk a little bit about the history of acupuncture. I mean, because this is a very ancient art. It's been around for a long time.
Very long time. Now, acupuncture actually is one modality of a bigger healing tradition, which is called traditional Chinese medicine. And traditional Chinese medicine involves acupuncture and things like herbal medicine. So it's a part of a bigger healing system. And traditional Chinese medicine goes back, at least the theories of it go back probably about 5,000 years in China. And they're usually kind of attributed to an emperor named Huangdi, who was known as the Yellow Emperor, and he's kind of a legendary figure in Chinese history. So that's about 5,000 years ago. And then throughout the millennia, it kind of migrated to Japan, Korea, other countries in the region, and they have their own kind of take on it, but it's still Chinese in origin. And then here we are in 2013, and we're doing it in the United States right here in Idaho.
And some interesting things about Chinese medicine is many people don't know or understand that the vast majority of our modern pharmaceutical medications actually originated from herbal medicine. They found things that actually worked, and because herbs can't be patented, what we did is we found, or we didn't, but the pharmaceutical companies found what was the elements that worked, and then they made those synthetically and can make more of them and promote them. But many of our medications actually originated from the things that do work with herbal medicine.
Absolutely. In fact, digitalis, which is a cardiac medicine, is a great example of that.
What about aspirin? Aspirin, I think, came from willow.
Correct. Willow, yeah. Native Americans were using willow bark as well.
I have pussy willows, and I have found it very effective to just take a little bit of fresh willow if I'm having pain, and just chew on it. It's amazingly effective.
Absolutely. Yep, absolutely.
So, I've even made willow tincture. So many things that we can learn. So now let's talk about move into the actual acupuncture, because you're right. People think that acupuncture and all these needles are painful. And I've had acupuncture, and it is not painful.
Yeah, I've been doing it for 10 years clinically. I've seen thousands of people, and I've estimated that I've probably inserted about 100,000 needles. So I know a thing or two about needling, and I can honestly say in 10 years, I'd have to really think long and hard about the number of people that just couldn't do it because of the physical discomfort. It's really not an issue. And one thing that I always do is I always make sure that I'm working within the limits of the person that I'm with. So the needles that I use are usually about 40 gauge, which is not much thicker than a human hair. Basically, it's tapped in very lightly and inserted usually not much more than about 1/8 of an inch. Most people don't feel any of that process. In fact, a lot of people are asking me if I've even put any needles in. Now, traditionally, when you go through, Chinese literature, they do emphasize that there is a little bit of a sensation with the insertion. And what it is, it's usually a very, very mild kind of a dullness or a pressure. And that is kind of an indication that there is a therapeutic effect going on with that needle. But it should be to the level that if I ask the patient, I say, do you feel that? Their response is, yeah, I think I feel that. So it's very, very mild. It's very, very moderate. And a lot of patients actually fall asleep on the table. Some people that are the most nervous are actually ones that conk out the hardest. So the needling is really not an issue, which is surprising to most people.
And that was my experience with it. I was surprised. You're right. There was a slight sense of pressure, but it was not painful and it was not uncomfortable.
Exactly.
So I think many people don't know that. I want to invite our listeners, if you have any questions about acupuncture, go ahead and give us a call. The number is 465-0730. And again, we are talking with Tony Burris. He is a licensed acupuncturist at Eagle Acupuncture. And you guys are located there in Eagle. Where in Eagle are you located?
We are right in the heart of downtown Eagle on Eagle Road between Old State Street and State Highway 44.
All right. And the number there is 938-1277. And we also have the website up on our page, but it's just eagleacupuncture.com. Lots of great stuff on the website.
Yeah, thank you.
So let's talk about what are the most common things that we can help with acupuncture. And one of the things that I want to emphasize here, which I really enjoyed about your website, is sometimes we think that we have to choose between modern medicine and some of the alternative or complementary medicines. And that's really not true. And one of the things that comes up on your website is that you do not even encourage people to give up modern medicine or allopathic medicine. You really are very involved in having this as a complementary and an integrative medicine. And I think more and more, I see this on Dr. Oz, I've seen it on a lot of television shows where many doctors are beginning to bring into their practice or into their referrals some of these medication or some of these modalities that don't have a lot of side effects, but can provide a lot of wonderful benefits.
Absolutely. A lot of people that come in, they ask me, well, if I come and see you, then do I need to stop doing my fill in the blank, my therapy or whatever it is that I'm doing? And I always tell people absolutely not, that you don't have to think of it in terms of, okay, if I go to this person and I don't get 100% relief, well, then that didn't work, so I'm going to move on to the next thing. And I go on to the next thing. Well, if that didn't give me 100% relief, well, then I'm going to go on to the next thing because that didn't work. If you do it that way, you're probably going to run the gamut of everything. So it's more likely that you're going to get maybe 40% relief doing one modality. You're doing something else, you might get 40% more relief. Now you're up to 80%, and maybe, you can fill in the last 20% with whatever, stretching, nutrition, or whatever. So I always encourage people to think in terms of doing several things to address their problem. That's probably the way, especially with a lot of really enduring kind of chronic problems, you're going to get the best relief.
Now, back to Peace of Mind, the show that discusses the physical, emotional, and intellectual pieces of health and wellness that help you find peace of mind. Here's your host, Brenda Harper.
All right, we're going to get back to our interview with Tony Burris from Eagle Acupuncture, and we want to remind you that if you have any questions about acupuncture, you can give us a call right here at 465-0730. Now, Tony, what does acupuncture have to do with fertility?
The question. Well, so first of all, let me just give you kind of the 30-second review of how acupuncture works, or what it's trying to do. And so what we're doing is, in Chinese medicine, you have about 365 points on your body that, and each one of them corresponds to certain regions or functions or processes or organs in your body. And so the theory is that by stimulating those points, you can affect those regions, organs, processes in the body. So what we're doing with fertility is just like we would do with anything else. We're stimulating certain points on your body that would be associated with the reproductive process. So in a woman's case, we would be, of course, if she's having trouble with, ovulation or certain aspects of her cycle, we can certainly affect that and potentiate that. We work with things like endometriosis or polycystic ovarian disorders that can be impediments to getting pregnant. So people don't really realize, but fertility is actually a very, very big niche in the acupuncture field. And I think this year we have helped close to a dozen women conceive.
Wow.
So, mm-hmm.
And that has to be quite a bit less bothersome and less troublesome than a lot of hormones, which can, have a lot of side effects. To my knowledge, there's not a lot of side effects to acupuncture.
Right. I mean, fertility can be a complicated subject because usually you're starting off, you have to get a menstrual cycle normalized. And since you're only having one of those a month, if it's normal, so it might take a couple months for you to start seeing, a result. But side effects, very, very little. People feel really good. So that's usually one side effect.
Well, let me ask you, how about PMS? Because is that helpful?
Absolutely. Yeah, again, so... PMS is, some aspects of PMS are somewhat normal with the cycle. There's the menstrual cycle is actually kind of a purging. It's a cleansing of the body in a sense. So it's actually a very normal and healthy function. But we certainly can help make it a more comfortable process. So we can reduce bloating, we can reduce breast tenderness, headaches, irritability, all those things. And that's a very common presentation that people come into our clinic with. Very, very common. Probably women's health and pain are probably the two most common things that we see.
So how often do you have a husband dragging his wife into your
Almost never. It's almost always the reverse.
Oh.
Almost always the reverse. Mm-hmm.
So women really are much more open and much more proactive, I think, in addressing their health issues.
Yeah, I'd say probably in my personal practice, it's probably 60% women, 40% men. And my wife is also a practitioner. She sees mainly women. So overall, I would say, it's overwhelmingly women. Mm-hmm.
Well, let's talk about some of the pain management, because that's one of the gold standards of acupuncture. We have a lot of research showing how effective acupuncture is in controlling a lot of different pains.
Mm-hmm.
Bursitis, for instance, that's a severe common pain. My understanding is that you guys are just amazing at treating that particular pain.
Well, I'd like to think so. My specialty is sports injury, pain management, chronic pain. That's what I specialize in. And, I've always been a weekend warrior my whole life, so I kind of gravitated towards sports injury. Low back pain is probably by far the most common thing that we see. Everybody suffers from low back pain probably at some point of their life. We do a lot of shoulders, a lot of necks, a lot of knees. And what's wonderful about acupuncture for pain relief is that the needle can work in many different ways. One of the ways that we use it is actually as almost like a physical therapy tool, where we are inserting the needle into the superficial layers of the muscle and getting the muscle to actually reset. So if people have muscle spasms, or if they have trigger points in their muscles, which are basically knots that are causing a lot of pain, we can actually stimulate those with a needle and get the muscle to actually twitch, and it will actually reset to its correct length. So if it's too tight, we can actually get it to reset to a longer, more comfortable length. So there's many different ways.
Does this help with like I think it's lactic acid that builds up within the muscles? Does it help release that as well?
It does. In Chinese medicine, pain is kind of lumped into one category, and that's the translatable character is stagnation. So in other words, something is stuck in that area that is causing you pain. And so the therapy is to get things to kind of move through that area. Okay? So lactic acid, inflammation, all those things are kind of termed in Chinese medicine as stagnation. So we want to kind of reintegrate the natural flow into that area. And getting that natural flow back into there is what reduces the pain. So yes, lactic acid, inflammation, all those things can be relieved with Chinese medicine.
I want to remind folks that you can give us a call here. The number is 465-0730. Again, 465-0730 if you have any questions about acupuncture. So what are some of the most common things besides sprains? Does this help speed the healing of a sprain or a, pulled muscle?
It does, yeah. So there's a natural process when somebody has an injury, right? When somebody twists their ankle over the weekend or somebody has a surgery, there's a natural process in your body that it goes through to heal itself, right? Moving healthy substances into that area to heal it, moving kind of the garbage or the residue of the healing process back out of there. There's fluids, there's blood, there's all kinds of organic detritus that is moved in and out of that area. And acupuncture, again, can help speed up that process. So I have a lot of patients that come in that are post-surgery. And so, again, this is part of the integrative model that we use. So people go in, they may have a muscle tear treated, like a rotator cuff treated in surgery. They'll come to me while they're doing physical therapy, and I can basically help speed up that process, help their range of motion, reduce the pain, reduce the inflammation, and get them back to the game of life faster.
And my understanding is that a lot of doctors are beginning to use this complementary and integrative medicine. I know I believe it's Misty, I think they use acupuncture as well to help with the healing and the pain associated with cancer and treatment. So what are some of the things that you guys most often participate in conjunction with other therapies?
Well, again, probably the most common things we do are pain related to actual physical injuries, musculoskeletal injuries or ligament tears, that kind of thing. Second most common thing would be women's health. We do get a lot of referrals from OBGYNs around the valley, very, very common. We get a lot of referrals for headaches is a very common thing that we treat and a very effective thing, and that can be migraines, tension headaches, vascular headaches. Another thing is gastrointestinal diseases, irritable bowel, Crohn's, colitis. Those are very, very effective things to be treated with Chinese medicine. Acupuncture in Chinese medicine is very young in this country. Even though it's 5,000 years old, in this country it's fairly young. We're talking several decades. And it's kind of just now going through a lot of the testing that we would kind of use as the gold standard for our how we judge medical treatments. And so a lot of doctors they don't really know what it can do is where that comes down. And so what we do is we really try to let doctors know how we can help patients and how we can participate in getting their people better. So a lot of it's just all of us learning together about how we can help each other.
Wow, I just think it's so great that you're really out there working with and helping integrate. Again, I want to remind you the number is 465-0730. If you have any questions about acupuncture, I have tons of them because I find it very fascinating. Some of the things that I've seen it work on headaches, but I just had, as we're talking here, I'm wondering, what about things like someone who's doing dental work? Is this used to help either with the relaxation or even with the, stopping the pain of dental work? And we'll come back to that question after a commercial break. But I want to think about that. Is this something that people do use in place of other pain medicines and stuff?
Absolutely.
We'll be back with the answer to that, and we're also going to talk about children's medicine, how this can help in a whole lot of things with children, including bedwetting and digestive problems and even attention. So we'll be back after these messages. You're listening to News Radio KINF 99.1 FM, and we'll be right back.
Connect with Brenda Harper and Peace of Mind on KINF 99.1 FM and 7:30 AM. To talk to Brenda, call 208-465-0730.
We're going to get back now to our interview with Tony Burris from Eagle Acupuncture. And Tony, I want to know how often, well, first we want to finish the question that we had before of, is this used for pain, such as surgery pain or dental pain? Maybe not here, but as an ancient use. Has it been used for that sort of pain treatment?
It is. In fact, in China, that's one of the main uses of it. In fact, there's a whole series of points on the back. They're called Huatou Jiaji points, and they are named after a very famous Chinese surgeon named Huatou, and how he applied those points on the back to reduce pain in all parts of the body and different organs. So we have some, modern refinements that we can use. One of those is like a TENS machine, which is basically a unit that you attach to some of the needles, and it emits a biphasic electric pulse to the needles, which strengthens the effect of the needle, and that'll get your body to release endorphins, enkephalins, dynorphins, all these wonderful biochemicals in your body that reduce pain and make you feel good. That's something that they didn't have available to them 1,000 years ago, but that's one of the refinements that we've added today that can make it that much more effective.
Is this ever used with delivery, birth?
It is. In fact, my wife, who is also an acupuncturist with me at Eagle Acupuncture, she has experience providing acupuncture during birth. I've never done that, but it is done, and she has done that. Wow. Absolutely.
I think that's cool. Let's talk about, because I know a lot of people who come in aren't coming in necessarily for chronic pain, or for acute pain, but they do often end up in your office for chronic pain, ongoing pain. Mm-hmm. And what is someone looking at as far as treatment? How many treatments does it take? And do they get permanent relief, or is this something that they have to continue forever?
Yeah, chronic pain is a whole subject unto itself. It's a little different than, like we say when you twist your ankle on Saturday playing volleyball. Chronic pain, being something you've had for a number of months, a number of years, is a totally different field of study, because oftentimes, even though the injury itself may have resolved, that message, that pattern of pain is ingrained in your system. So the first thing I tell people is to be patient. You want to think of acupuncture as a therapy. This is how it works. So what we're doing is we're basically sending a message to your body for your body to do the healing. So you want to think in terms of, we're going to start here. Let's do X number of treatments before we kind of sit back and say, okay, what kind of a result are we getting? Generally, for chronic pain, if somebody's had it for more than a month, they experience it every day, it's affecting one of the big pillars in their life, so sleeping, work, household relationships. Kind of my general protocol is I like to see them twice a week for the first 2 weeks, and then maybe once a week for a couple weeks after that. By those 4 to 6 visits, if what I'm doing for you is going to help you, you'll know. We'll either have a lot of relief, or at least at the very least be going in the right direction. But that's kind of my general protocol, is think in terms of 4 to 6 visits within 2 to 4 weeks.
As you're talking, I'm wondering, because I've worked a number of times with people who have phantom pain, people who have amputation, and there's often a phantom pain. How effective is this in dealing with that kind of pain?
It's very effective. One of the ways that we treat that is to treat the opposite side of the body. So if they're having, pain, phantom pain, where their left arm would have been, we just treat the same points on the right arm. Or what we can do is you can treat points on the ear, since the ear is considered a microsystem. So what that means is that your ear is kind of, in acupuncture terms, is kind of like a little body, and all the points of the body are represented on the ear. So we can treat points on the ear that may be where that missing limb would be. And so your brain doesn't really know the difference.
It is truly fascinating. I want to remind folks that if you have any questions about acupuncture, you can give us a call here. The number is 465-0730. This is your opportunity to learn a little more about this. But also, if you're having pain, if you're having any of these issues, I'd recommend going in and at least trying it. I have found it to be an amazing modality and a good addition to medical care. I want to talk a little bit about, while we still have time, about treating children, because you actually, on your website, talk a lot about there are a number of things in which you can help with children's, like ear infections, bedwetting, digestive problems, headaches, reoccurring nightmares, anxiety, even ADHD. Mm-hmm. So let's talk just a little bit about how you work with kids.
Well, I love kids. I have two of my own. And, generally when kids come in, it's usually about 11 or 12 years old when we'll start to consider actually putting a needle in them. That's when they're usually, some kids are usually somewhat open to it. Okay. Prior to that age, what we do is we use something called a pediatric e-stim machine. And what that basically is what we call the Tickle Machine. And it's basically two probes, look like ballpoint pens. And they have some wires that are attached to a little box, like a little transistor radio box. And it simply emits a pulse. And what I do is I put those probes on the points that I would normally needle on an adult. And I just put that probe on the point for about 30 seconds. And all the child feels is a very mild pulse. And it's not uncomfortable at all. A lot of times they have to kind of think about whether they feel it or not. And that replaces the stimulation of the needle. So we call that the Tickle Machine. So it's acupressure, basically, is what it is. It's very comfortable. Kids tend to move around a lot, so they're not going to lie there with some needles in them. So the treatments are usually very short. Children are great because they tend to get better a lot faster than adults. They tend to get sicker a lot faster, but they also tend to get better. So generally my results with children that I treat, they like it, they think it's cool, and they generally get pretty good results.
I was interested in the bedwetting because, as a therapist, that's something that I dealt with quite a bit, and it's such a frustration, and we don't have a lot of real effective treatments. They do have some medications, but they all have side effects. So how does that work?
It's, in Chinese medicine, they associate certain emotions, certain cognitive functions, certain mental processes with each of the organs. And bedwetting is often associated with fear, whether it's latent or overt, and that's associated with the kidneys in Chinese medicine. Now, kidneys also obviously have a direct impact on urination, but we would usually work with the kidneys in that sense. So we would needle points or treat points with our Tickle Machine on the low back, on the legs, on the feet. And I have done a few cases of bedwetting, and it generally responds really, really well. We can also use herbs. Herbal medicine is very, very effective with children. We just reduce the dose. You can put a little bit in applesauce or yogurt. Children eat it. It's no problem. And again, the same idea, herbs that help with the kidneys.
Wow.
Mm-hmm.
So and you do practice herbal medicine as well, not just the acupuncture.
Absolutely. That's probably, about 60% of our practice is probably acupuncture, and the other 40% is herbal medicine. And that's one of the licensed practices that we have here in Idaho. And what we do is we prescribe formulas. So in other words, when you go to just like a Whole Foods or someplace like that, you'll buy herbs that are singly, right? You'll buy ginseng or St. John's wort or black cohosh. Chinese medicine's a little bit different, and they practice polypharmacy. And what that means is that the herbs are put in formulas together. So anywhere from 3 to 15 herbs together, kind of like a recipe, so that they work synergistically. And there's volumes and volumes of classical Chinese herbal formulas for everything under the sun that you can think of.
Wow. Tony, I really want to thank you for being here and sharing all this fascinating information. Again, how do folks get hold of you? What's your address and your phone number?
We are located in the heart of Eagle, right in downtown Eagle at 128 South Eagle Road, between Old State Street and Highway 44. Our number is 938-1277, and they're always welcome to visit our Facebook page, which is very lively. That's facebook.com Eagle Acupuncture, or our website at eagleacupuncture.com.
All right. We really appreciate you being here. Thank you
appreciate
so
it.
much. And I hope folks go check out your website because there's a lot of great information there as well. I do want to thank all of our listeners for being here today. And I want to remind you that life is a series of struggles sprinkled with moments of joy. And he or she who gather those moments best enjoy the journey most. We hope that you have a wonderful week and that you will also join us here next week, and we will be have a great show for you. And again, if you want to learn more about acupuncture, please check out Eagle Acupuncture. Thanks for being here today, and we'll see you right here on 99.1 FM next week.